This video lecture was made by the Center for Future Dentistry under the SNUSD Knowledge Share Initiative with the support of the Korean Ministry of Trade, Industry, and Energy. Welcome to the Vanatomy, the 17th lecture of this series. I'm Dr. Strategy. Following the past session, the part 1, let's look at the muscles that you need to know to understand the head and neck anatomy, starting with the neck muscles. The first is the superficial muscles of the neck. Platysma muscle. This muscle is a superficial muscle of the human neck that overlaps the sternocleidomastoid muscle. It covers the anterior surface of the neck superficially. When it contracts, it produces a slight wrinkling of the neck and a bowstring effect on either side of the neck. It is a broad sheet of muscle arising from the fascia covering the upper parts of the pectoralis major muscle and deltoid muscles. Its fibers cross the clavicle and proceed obliquely upward and medially along the side of the neck. This leaves the inferior part of the neck in the midline deficient of significant muscle cover. So, the origin of this muscle can be said as the skin or fascia of infraclavicular and supraclavicular regions. This muscle inserts to the lower border of the mandible, skin of the buccal and cheek region, lower lip, modiolus, and orbicularis oris muscle. Sometimes fibers can be traced to the zygomaticus major muscle or to the margin of orbicularis oris muscle. Beneath the platysma, the external jugular vein descends from the angle of mandible to the clavicle. This muscle is supplied by the cervical branch of the facial nerve and is supplied the branch of the submental artery and suprascapular artery. Regarding the relations to other muscles, the platysma muscle lies just deep to the subcutaneous fascia or fat. It covers many structures found deeper in the neck, such as the external carotid artery, the external jugular vein, the parotid gland, the lesser occipital nerve, the greater auricular nerve, and the marginal mandibular branch of the facial nerve. Aside from the wrinkling of the neck, the anterior portion of the platysma muscle, the thickest part of the muscle, depresses the lower jaw. It also draws down the lower lip and the angle of mouth in a frown. However, the platysma muscle plays only a minor role in depressing the lower lip, which is primarily performed by the depressor anguli and the depressor labii inferioris muscle. The antagonist of the platysma muscle can be said as the masseter and temporalis muscle. The next muscle I would like to say is included in the lateral clavicular muscles of neck. Sternocleidomastoid muscle. It is one of the largest and most superficial cervical muscle. It is given the name sternocleidomastoid because it originates at the manubrium of sternum and the clavicle and has an insertion at the mastoid process of the temporal bone. The sternocleidomastoid muscle originates from two locations. The sternal head is round fasciculus, tendinous in front, flesh behind, arising from the upper part of the front of the manubrium sterni. It travels superiorly, laterally, and posteriorly. The clavicular head is composed of flesh and aponeurotic fibers, arises from the upper frontal surface of the medial third of the clavicle. It is directed almost vertically upward. The two heads are separated from one another at their origins by a triangular interval, which is as known as lesser supraclavicular fossa, but gradually blend below the middle of the neck into a thick, rounded muscle which is inserted by a strong tendon into the lateral surface of the mastoid process from its apex to its superior border, and by a thin aponeurosis into the lateral half of the superior nuchal line of the occipital bone. This muscle is innervated by accessory nerve of the same side. It supplies only motor fibers. So, the cervical plexus supplies sensation, including proprioception, from the ventral primary rami of C2 and C3. The function of this muscle is to rotate the head to the opposite side or obliquely rotate the head. It also flexes the neck. When both sides of the muscle act together, it flexes the neck and extends the head. When one side acts alone, it causes the head to rotate to the opposite side and flexes laterally to the same side, that is to say, ipsilaterally. It also acts as an accessory muscle of respiration, along with the scalene muscle of the neck. The next is the suprahyoid muscle groups, which consist of 4 muscles. Digastric muscle. It is also called as digastricus. The name digastric means that it has 2 bellies. It is a small muscle located under the jaw. The term digastric muscle refers to this specific muscle, but other muscles that have 2 separate muscle bellies include the suspensory muscle of duodenum, omohyoid, and occipital frontalis. This muscle lies below the body of mandible and extends in a curved form from the mastoid notch to the mandibular symphysis. A broad aponeurotic layer is given off from the tendon of the digastric muscle on either side to be attached to the body and greater cornu of the hyoid bone. This is termed as the suprahyoid aponeurosis. The digastric muscle consists of 2 muscular bellies united by an intermediate rounded tendon. The 2 bellies of digastric muscle have different embryological origins and are supplied by different cranial nerves. The posterior belly, longer than the anterior belly, arises from the mastoid notch, which is on the inferior surface of the skull, medial to the mastoid process of the temporal bone. It lies posterior to the parotid gland and the facial nerve. The mastoid notch is a deep groove between the mastoid process and the styloid process. The posterior belly is supplied by the digastric branch of the facial nerve. The digastric muscle stretches between the mastoid process of the cranium to the mandible at the chin, and part away between, it becomes a tendon which passes through a tendinous pulley attached to the hyoid bone. The posterior belly originates from the second pharyngeal arch. On the other hand, the anterior belly arises from a depression on the inner side of the lower border of the mandible, called as the digastric fossa of the mandible, close to the mandibular symphysis, and passes downward and backward. The anterior body is supplied by the trigeminal via mylohyoid nerve, a branch of the inferior alveolar nerve, itself a branch of the mandibular division of the trigeminal nerve. This belly originates from the first pharyngeal arch. The 2 bellies end in an intermediate tendon which perforates the stylohyoid muscle and is held in connection with the side of the body and the greater cornu of the hyoid bone by a fibrous loop which is sometimes lined by a mucous sheath. The digastric muscle is involved in any complex jaw action such as speaking, swallowing, chewing, and breathing. When the digastric muscle contracts, it acts to elevate the hyoid bone. If the hyoid is being held in place by the infrahyoid muscle, it will tend to depress the mandible. So, it opens the mouth. The anterior belly is supplied by the segmental branch of the facial artery. On the other hand, the posterior belly is supplied by the occipital artery. Stylohyoid muscle. It is a slender muscle lying anterior and superior of the posterior belly of digastric muscle. This muscle originates from the posterior and lateral surface of the styloid process of temporal bone near the base. Passing inferior and anterior, it inserts into the body of the hyoid bone at its junction with the greater cornu and just superior to the omohyoid muscle. This muscle is perforated near its insertion by the intermediate tendon of the digastric muscle. The stylohyoid muscle has vascular supply from the lingual artery, a branch of the external carotid artery. A branch of the facial nerve innervates the stylohyoid muscle. Its action is to elevate the hyoid during swallowing. It functions to draw the hyoid bone backward and elevate the tongue. Mylohyoid muscle. This muscle is also called as a diaphragm oris. It is a paired muscle of the neck. It runs from the mandible to the hyoid bone, forming the floor of the oral cavity of the mouth. It is named after its two attachments near the molar teeth. It forms the floor of the submental triangle. It elevates the hyoid bone and the tongue, important during swallowing and speaking. This muscle is a flat and triangular and is situated immediately superior to the anterior belly of digastric muscle. It is a pharyngeal muscle, which means it is derived from the first pharyngeal arch and are classified as one of the suprahyoid muscle. Together, the paired mylohyoid muscle form a muscular floor of the oral cavity of the mouth. The two mylohyoid muscle arises from the mylohyoid line of the mandible, which extends from the mandibular symphysis in front to the last molar tooth behind. The posterior fibers pass infromedially and insert at the anterior surface of the hyoid bone. The medial fibers of the two mylohyoid muscles united in a midline raphe, where two muscles are intermeshed. The mylohyoid muscle is supplied by a branch of the mandibular nerve, the inferior alveolar nerve. The mylohyoid nerve is a branch of the inferior alveolar nerve. The mylohyoid nerve emerges to give motor supply to the mylohyoid muscle. These muscles are derived from embryonic mesoderm, specifically the first pharyngeal arch. It is supplied by mylohyoid branch of the inferior alveolar artery and segmental artery of facial artery. Geniohyoid muscle. It is a narrow muscle situated superior to the medial border of the mylohyoid muscle. It is named for its passage from the chin to the hyoid bone. This muscle arises from the inferior mental spine on the back of the mandibular symphysis and runs backward and slightly up downward to be inserted into the anterior surface of the body of the hyoid bone. It lies in contact with its fellow of the opposite side. Thus, it belongs to the suprahyoid muscles. This muscle is supplied by the branch of the lingual artery. It is innervated by fibers from the first cervical nerve traveling alongside the hypoglossal nerve. Although the first three cervical nerves give rise to ansa cervicalis, the geniohyoid muscle is said to be innervated by the first cervical nerve, as some of its efferent fibers do not contribute to ansa cervicalis. The geniohyoid muscle brings the hyoid bone forward and upward. This delays the upper airway, assisting respiration. During the first act of deglutition, when the mass of food is being driven from the mouth into the pharynx, the hyoid bone, and with it, the tongue, is carried upward and forward by the anterior belly of digastricus muscle, the mylohyoid muscle, and geniohyoid muscle. It also assists in depressing the mandible. The next is the infrahyoid muscle groups. Sternocleidomastoid muscle. This muscle is one of the paired strap muscles. It arises from the posterior border of the medial end of the clavicle, the posterior sternoclavicular ligament, and the upper and posterior part of the manubrium sterni. Passing upward and medially, it is inserted by short tendinous fibers into inferior border of the body of the hyoid bone. It runs lateral to the trachea. This muscle is supplied by a branch of ansa cervicalis and is supplied by the superior thyroid artery. The sternohyoid muscles perform a number of functions. It depresses the hyoid bone, and it helps with speech, primarily to do with volume rather than the intonations. And it helps to move the head of the neck. Omohyoid muscle. It is a muscle that depresses the hyoid bone. It is located in front of the neck and consists of two bellies separated by an intermediate tendon. This muscle is proximally attached to the scapula and distally attached to the hyoid bone, and stabilizing the hyoid bone. Its superior belly serves as the most lateral member of infrahyoid muscles, located lateral to the both sternothyroid and the thyrohyoid. The superior belly of this muscle originates from the intermediate tendon and inserts to the body of the hyoid bone. The inferior belly originates from the superior border of scapula near the suprascapular notch and inserts to the intermediate tendon. The omohyoid is innervated by a branch of the cervical plexus, the ansa cervicalis. The inferior valley of the omohyoid is innervated by three cervical branches, as known as C1 to C3, that make up the ansa cervicalis, while the superior belly is innervated by the superior root of ansa cervicalis, which contains only fibers from the first cervical spinal nerve. Its arterial supplies are from the branches from the inferior thyroid artery. Its action is to depress the larynx and the hyoid bone. It also carries the hyoid bone backward and to the side. Sternothyroid muscle. It is below the sternohyoid muscle, and it is shorter and wider than the sternohyoid. The sternothyroid muscles arises from the posterior surface of the manubrium sterni below the origin of the sternohyoid. It also arises from the edge of the cartilage of the first rib. It is inserted into the oblique line of the lamina of the thyroid cartilage. It is in close contact with its fellow at the lower part of the neck, but diverges somewhat as it ascends. It is occasionally traversed by a transverse or oblique tendinous inscription. This muscle is innervated by the ansa cervicalis, and the arterial supplies are from the superior thyroid artery. The sternothyroid muscle depresses the hyoid bone along with the other infrahyoid muscles. Thyrohyoid muscle. It is a quadrilateral muscle in shape and appears like an upward continuation of the sternothyroid muscle. It lies in the carotid triangle. This muscle arises from the oblique line of the lamina of the thyroid cartilage and is inserted into the inferior border of the body and greater corner of the hyoid bone. The thyrohyoid muscle is innervated by the hypoglossal nerve, and it is the only infrahyoid muscle that is not supplied by the ansa cervicalis. It may also be supplied by the thyroid branch of the first cervical spinal nerve. This nerve branches from the first cervical nerve as it joins the hypoglossal nerve for a short distance. The thyroid muscle depresses the hyoid bone and elevates the larynx and thyroid cartilage, drawing them together. By controlling the position and shape of the larynx, it aids in making sounds. It is supplied by the superior thyroid artery. Moving on to the anterior muscles of the neck. Longus colli. This muscle is situated on the anterior surface of the vertebral column between the atlas and the third thoracic vertebra. It is broad in midline, narrow, and pointed at either end, and consists of three portions: a superior oblique, an inferior oblique, and an intermediate vertical. The superior oblique portion arises from the anterior tubercle of the transverse process of the third, fourth, and fifth cervical vertebrae and ascending obliquely with a medial inclination. It is inserted by a narrow tendon into the tubercle on the anterior arch of atlas. The intermediate vertical portion arises below from the front of the bodies of the upper three thoracic and lower three cervical vertebrae and is inserted into the front of the bodies of the second, third, and fourth cervical vertebrae. The inferior oblique portion, the smallest part of the muscle, arises from the front of the bodies of the first two or three thoracic vertebrae and ascending obliquely in a lateral direction and is inserted into the anterior tubercles of the transverse process of the fifth and sixth cervical vertebrae. It is supplied by the ascending pharyngeal artery and vertical arteries and is innervated by second to sixth cervical spinal nerves. Its main action is to flex the neck and head. Longus capitis muscle. This muscle is broad and thick above and narrow below and arises by four tendinous slips from the anterior tubercle of the transverse process of the third, fourth, and fifth and sixth cervical vertebrae, and ascends, covering towards its fellow of the opposite side to be inserted into the inferior surface of the basilar part of the occipital bone. It is innervated by a branch of the cervical plexus. From C1 to C3 or C4, Longus capitis have several actions, acting unilaterally to flex and head and neck laterally, or to rotate the head ipsilaterally. When acting bilaterally, this muscle flexes the head and neck. Rectus capitis anterior. It is also called as rectus capitis anticus minor. This muscle is a short flat muscle situated immediately behind the upper part of the longus capitis. It arises from the anterior surface of the lateral mass of atlas and from the root of its transverse process and passing obliquely upward and medialward. Is inserted into the inferior surface of the basilar part of the occipital bone immediately in front of the foramen magnum. Its action is to aid in flexion of the head and neck, and it is innervated by the C1 and C2. Rectus capitis lateralis. It is a short, flat muscle arises from the upper surface of the transverse process of the atlas and is inserted into the under surface of the jugular process of the occipital bone. It is innervated by the C1 and C2, and its action is lateral flexion and to stabilize atlanto-occipital joint. Okay, move on to the posterior muscles of the neck. The first one is the rectus capitis posterior minor muscle. It is also called as rectus capitis posticus minor. It arises by a narrow pointed tendon from the tubercle on the posterior arch of the atlas and widening as it ascends, and is inserted into the medial part of the inferior nuchal line of the occipital bone and the surface between it and the foramen magnum, and also takes some attachment to the spinal dura mater. It is innervated by a branch of dorsal primary division of suboccipital nerve. This muscle extends ahead at neck, but is now considered to be a more sensory organ than a muscle. Rectus capitis posterior major muscle. It is also called as rectus capitis posticus major. This muscle arises by a pointed tendon from the spinous process of the axis and becoming broader as it ascends, and is inserted into the lateral part of the inferior nuchal line of the occipital bone and the surface of the bone immediately below the line. Its main action are to extend and rotate the atlanto-occipital joint ipsilaterally. It is supplied by the occipital artery and is innervated by the dorsal ramus of the C1, as known as the suboccipital nerve. Obliquus capitis superior muscle. It is a small muscle in the upper back part of the neck and is one of the suboccipital muscles and part of the suboccipital triangle. It arises from the lateral mass of the atlas. It passes superiorly and posteriorly to insert into the lateral half of the inferior nuchal line on the external surface of the occipital bone. The muscle is innervated by the suboccipital nerve, the dorsal ramus of the first cervical spinal nerve. It acts at the atlanto-occipital joint to extend the head and flex the head to the ipsilateral side. Obliquus capitis inferior muscle. It is the larger of the two oblique muscles of the neck. It arises from the apex of the spinous process of the axis and passes laterally and slightly upward to be inserted into the lower and back part of the transverse process of the atlas. It lies deep to the semispinalis capitis and trapezius muscle. This muscle is responsible for rotation of the head and the first cervical vertebra. It means the atlantoaxial joint. It forms the lower boundary of the suboccipital triangle of the neck. The naming of this muscle may be confusing as it is the only capitis muscle that does not attach to the cranium. It is innervated by the suboccipital nerve. Semispinalis capitis muscle. It is frequently considered as back muscle rather than a cervical muscle. The semispinalis muscles are a group of 3 muscles belonging to the transversus spinalis. The transversus spinalis include the semispinalis and multifidus and rotatores. There are 3 semispinalis muscles, that is, the semispinalis capitis, the semispinalis cervicis, and the semispinalis thoracis. The semispinalis capitis is situated at the upper and back part of the neck, deep to the splenius, and medial to the longissimus cervicis and the longissimus capitis. It arises by a series of tendons from the tip of the transverse processes of the upper 6 or 7 thoracic vertebrae and the 7th cervical vertebrae, and from the articular process of the 3 cervical vertebrae above this. The tendons uniting form a broad muscle which passes upward and is inserted between the superior and inferior nuchal line of the occipital bone. It lies deep to the trapezius muscle and can be palpated as a firm round muscle mass just lateral to the cervical spinous process. It is innervated by greater occipital nerve. Longissimus capitis muscle. It is also classified as the back muscle rather than a cervical muscle. The longissimus muscle is the muscle lateral to the semispinalis muscles. It is the longest subdivision of the erector spinae muscles that extends forward into the transverse processes of the posterior cervical vertebrae. The longissimus capitis muscle is also called as the trachealomastoid muscles, lies medial to the longissimus cervicis between it and the semispinalis capitis. It arises by tendons from the transverse processes of the upper 4 or 5 thoracic vertebrae and the articular process of the lower 3 or 4 cervical vertebrae, and is inserted into the posterior margin of the mastoid process beneath the splenius capitis and the sternocleidomastoid. It is almost always crossed by a tendinous intersection near its insertion. It is innervated by the posterior branch of the spinal nerve, and its main action is laterally to flex the head and neck to the same side. Bilaterally is to extend the vertebral column. Splenius capitis muscle. It is a broad strap-like muscle in the back of the neck. It pulls on the base of the skull from the vertebrae in the neck and upper thorax. It is involved in movements such as shaking the head. This muscle arises from the lower half of the nuchal ligament, from the spinous process of the 7th cervical vertebrae, and from the spinous processes of the upper 3 or 4 thoracic vertebrae. The fibers of the muscle are directed upward and laterally and are inserted under cover of the sternocleidomastoid into the mastoid process of the temporal bone and into the rough surface on the occipital bone just below the lateral third of the superior nuchal line. The splenius capitis is deep to the sternocleidomastoid at the mastoid process and to the trapezius for its lower portion. It is one of the muscles that forms the floor of the posterior triangle of the neck. This muscle is innervated by the posterior ramus of the spinal nerve C3 and C4. It is supplied by the muscular branches of the aorta. The splenius capitis muscle is a prime mover for head extension. The splenius capitis can also allow lateral flexion and rotation of the cervical spine. The next is the scalene muscles. The scalene muscles are a group of three pairs of muscles in the lateral neck, namely the anterior scalene, middle scalene, and the posterior scalene. They are innervated by the fourth, fifth, and sixth cervical spinal nerve. The anterior and middle scalene muscles lift the first rib and bend the neck to the same side. The posterior scalene lifts the second rib and tilts the neck to the same side. The muscles are named from ancient Greek skalenos, that means uneven. Scalenus anterior muscle. This muscle lies deeply at the side of the neck behind the sternocleidomastoid muscle. It arises from the anterior tubercle of the transverse process of the third to sixth cervical vertebrae, and descending almost vertically is inserted by a narrow flat tendon into a scalene tubercle on the inner border of the first rib and into the ridge of the upper surface of the second rib in front of the subclavian groove. It is supplied by the anterior ramus of the cervical nerve 5 and 6. Its action is, when neck is fixed, to elevate first rib to aid in breathing, or when rib is fixed, bends neck forward and sideways and rotate it to opposite side. It is supplied by the ascending cervical artery, as known as the branch of the inferior thyroid artery. Scalenus medius muscle. The middle scalene muscle is the largest and longest of the three scalene muscles. The middle scalene arises from the posterior tubercles of the transverse process of the lower six cervical vertebrae. It descends along the side of the vertebral column to insert by a broad attachment into the upper surface of the first rib, posterior to the subclavian groove. The brachial plexus and the subclavian artery pass anterior to it. Its main action is to elevate the first rib and rotate the neck to the opposite side. It is innervated by the ventral rami of the third to eighth cervical spinal nerve and is supplied by the ascending cervical artery. Scalenus posterior muscle. The posterior scalene muscle is the smallest and most deeply seated among the scalene muscles. It arises by two or three separate tendons from the posterior tubercles of the transverse processes of the lower two or three cervical vertebrae and is inserted by a thin tendon into the outer surface of the second rib behind the attachment of the anterior scalene. It is supplied by the cervical nerve C5, 6, and 7, and it is occasionally blended with the middle scalene. Its arterial supplies from ascending cervical artery and superficial cervical artery. Its main action is to elevate the second rib and to tilt the neck to the same side. The final muscles we will discuss in part 2 is the muscles of back. There is only one muscle that we discuss in part 2 as a back muscle, the trapezius. The trapezius is a large paired trapezoid-shaped surface muscle that extends longitudinally from the occipital bone to the lower thoracic vertebrae of the spine and laterally to the spine of scapula. It moves the scapula and supports the arm. The trapezius has three functional parts: an upward descending part which supports the weight of the arm, a middle transverse region which retracts the scapula, and a lower ascending part which medially rotates and depresses the scapula. Overall, the trapezius has its origin at medial third of the superior nuchal line, external occipital protuberance, nuchal ligament, and spinous process of C7 to T12 vertebrae. And this muscle has its insertion at the lateral third of the clavicle and acromion and spine of scapula. Contraction of the trapezius muscle can have two effects: movement of scapula when the spinal origins are stable, and movement of the spine when the scapulars are stable. Its main function is to stabilize and move the scapula. It is innervated by the accessory nerve, motor part, and cervical spinal nerve from C3 and C4. It is supplied by the superficial branch of transverse cervical artery or superficial cervical artery. It has antagonists such as serratus anterior and latissimus dorsi and pectoralis major. Okay, this is the end of the part 2 of the summary of head and neck muscles. In part 3, the rest of muscles will be discussed in detail. Thanks for watching.